Good morning. I'm Don Walker, and I'm Communications Director for Brevard County Government, and we are here for our bi-weekly update on the COVID-19 pandemic. Today, we have panelist Maria Stahl, who is the Administrator for Florida Department of Health Brevard. We have John Scott, who is our Emergency Management Director. Matt Wallace, who's the county's Public Safety Director. We have Catherine Allen, who is with Brevard Public Schools, and we also have Jesse Ray, our social media specialist, who will be monitoring the Facebook Live event, including any questions that are posed from the audience. We will try to answer as many of those as possible at the conclusion of our update. So, as we always do, we will start off with Maria Stahl with an update on the pandemic. Maria?
Hi, good morning, everyone. I'm Maria Stahl from the Florida Department of Health in Brevard County, and I will start with our current status of our cases. We have 351 cases. That's an increase of 102. Our labs reported out today at a 5.65% positivity rate. Overall, 13.68 positivity rate. We did add one death today. Our deaths are 793. Our deaths related to long-term care facilities continue to be about 50%. We did add no new deaths there. Our long-term care facilities are actually doing very good right now. We have a few cases here and there, but none of them that have any outbreaks. Our hospitals continue to be stable, as they have been all along, and they have bed capacity in both their ICU and their medical surgical areas. Moving on to vaccine administration, currently as of today, 669 residents have received at least one dose of vaccine. 485 residents are completely vaccinated. Looking at percentages, we have 44% of our residents over the age of 50 that have received a vaccine, at least one dose. And over the age of 65, we have 62% of our residents that have received the vaccine. When we look at our 2-week trend, our positivity rate over 2 weeks is 5.3%. Our average cases per day have been 96, and we've added 21 deaths over the 2-week period. Two things that we are noticing is our median age of cases is starting to decrease. It was in the 40s, now it's predominantly in the 30s. The other thing, we were starting to see a little bit of decline in cases. We're no longer seeing the decline. We're seeing, just as they're talking about on the news, that you've seen more of a stabilization. So we're kind of just staying right where we're at, which could be a little troublesome. We're not seeing the increase, we're not seeing the decrease. So as I say that, I strongly encourage everyone to get the vaccine when it becomes available. John will talk a little bit more about that. Definitely continue the mitigation measures, wearing face coverings when you're out in public, hand washing, continue to stay home when you're sick, and social distancing when you can.
All right, thank you, Maria. For a vaccine update and news from the governor today, I'll turn it over to John Scott with Emergency Management.
Thank you, Don. Again, my name is John Scott. I'm the Emergency Management Director. I'll start with what Don alluded to, which is the governor's announcement earlier this morning. Beginning Monday, March 29th, you'll see a lowering of the age to 40 and above. And then the following week, April 5th, you'll see a lowering of the age to 18 and over. So that's all good news. That means we're broadening out. We're making it more eligible for our residents in an incremental and methodical fashion. But I also want to manage expectations. Just because we've opened it up doesn't mean we're going to see a sudden influx of the amount of vaccine to address all of those groups. So we'll continue, like we are today, continue to be in a more demand than we have supply for. The good news in that, to go along with the opening of groups, is that we are continuing to see vaccine increase statewide. Now, that doesn't necessarily mean that more vaccine is going to our friends at the Department of Health, but we're seeing increased supplies go to pharmacies. This past week, Walgreens and CVS began to offer vaccinations in Brevard County, and you can go to both of their websites, just like you can for Publix, Walmart, Sam's Club, and Winn-Dixie. They're all offering those at select locations throughout the county. And our expectation is, as more vaccine is manufactured and comes available from the federal government, they will continue to push a bunch of that vaccine to those pharmacies. Great news for us on all accounts. What we have been talking about, here the entire time is, we're working with the Department of Health, our primary pod here in Viera at the Viera Health Department Clinic, but we're also working with community partners and the state of Florida to identify underserved populations and try to get out as much as we can to them. That doesn't mean we're doing it in a large-scale fashion because we simply don't have the supply to do it. But we are taking a little bit of vaccine here, a little bit of vaccine there, and trying to get it out to those communities who do have access issues, who do have transportation or technology barriers, and trying to make it more available. We will continue to do that throughout the duration of this until we reach as many people as we can that are as interested in it as it takes. But we're also limited by our supply. So as we get more supply, we'll scale up those operations, we'll offer them more frequently, but we really are working with community partners, and it's been very successful so far, to identify target populations, to identify those folks with either technological or transportation barriers, and try to get out to them more and more. The last thing I want to say on this is really just to try to continue to manage expectations. We're all very excited that in the next couple of weeks and by the start of April, a vaccine is going to be available to anyone who is 18 and older. And I just want to clarify why 18 and older and why not 16 and older. 16 and older, Pfizer is the only vaccine that's been approved for folks between the ages of 16 and 18. Both Moderna and Johnson & Johnson are 18 and older. So 18 and older is the standard barrier, or standard minimum. But on that, as we continue to sort of see those groups go, again, we don't necessarily have the supply to reach all of those groups right away. So just because you're eligible doesn't mean you're going to get your shot right away. So it's critically important that you follow what Maria said, which is, again, continue to do those mitigation measures that have gotten us this far. You heard her talk about the idea that we're stabilizing. That's great, but we need to get it on a decrease. In order to get it on a decrease, that means more folks have to get vaccinated when it's made available to them. And that means we have to continue to wear masks, wash our hands, practice social distancing, and avoid large crowds until we're all in a much better place and we're all sort of reaching that herd immunity area. So hang in there with us. We have preached from day one that this is a long, long, long fight, but that we are making incremental progress and that every time we talk to you, the situation is getting better, which is great news for all of us. But we don't want to stop now before we reach the finish line. So we're going to continue to implore you to hang in there with us and know that we're working absolutely as hard as we can to get out as much vaccine to folks as fast as we get it. Don?
Thank you, John. If you are eligible, you meet the eligibility requirements. So, for example, right now you're 50 and older, and effective Monday you're 40 and older. I highly encourage you to go to the state registry website at myvaccine.fl.gov to sign up, get your name on that registry, and they will contact you when appointments are available. But that said, I also want to say that don't limit your chances of getting an appointment. So these other places that John mentioned that will be, are, or could be soon getting the vaccine, they announce appointments as well on a week-to-week basis. So if you can get a vaccination at Publix or any of the other retailers or areas that are getting the vaccine, don't limit the possibility that you could get called sooner than later to get your vaccine, because we do know that there's that demand out there. So I will turn it over now to Matt Wallace for an update on the federal stimulus money. Matt?
Thank you, Don. And good morning, Brevard County. Thank you again for tuning in with us on an every other week basis. We appreciate you tuning in and spending a few minutes with us as we get this critical information out. As our emergency management director stated earlier, this is a marathon, not a sprint. There are sprint times in a marathon, but overall, it's going to be a long journey. And your patience and being informed and keeping up with what's happening are going to be keys for us to winning this thing. As Don said, I have a couple updates of where we are from the federal relief programs, the America Rescue Plan, spending plan that is coming down. We talked about it a little bit at our last update 2 weeks ago. Since then, we've got just a few more details. A couple of those are, it looks like Brevard County is in line for about $118 million from the federal government for this program. We know it'll be coming in two chunks. The first chunk looks like we're going to be seeing the first chunk maybe in May, mid to late May-ish. We will continue to work with the federal government and all our folks that are working with us to get more details. There are some preliminary details about the program's outlines. We're going through those now, and we'll figure out a way to work with the commission to get that out to the folks once we find out what those federal guidelines are. That I did say that first chunk will be coming sometime in May-ish. We're expecting about $60 million in the first trunk. And then the second half of the money, the other $60 million, we're anticipating it to come about a year later. So we're going to be getting two stimulus inputs into Brevard County about a year apart. And again, a lot more to come as we figure out the program and we figure out the stipulations, and we'll be sure to update you through this venue as well as BOCC meetings, as well as Don's PIO reports that we send out to the county as we get more information on those. And again, before I get out of here, again, thank you for your patience, Brevard County. It has been a fight. It's been a long time coming since last March where we first started talking about this, and here we are a year into it. But we are making progress. So please stick with the plan. Please be patient. Please do all those great things that we've been asking you to do, and we'll make it to the finish line, no doubt. So thank you again. Don, thank you, sir.
Thank you, Matt. And this is also important to note, along with the stimulus money that we're anticipating, we have been provided $18 million by the federal government that the county is currently utilizing to help people with rental assistance. So if you're having trouble paying your apartment rent, or you need help either making a security deposit, or you are having utility issues and are suffering because of the COVID-19 pandemic financially, there is help available. We have applications at all 17 county libraries, and it's also posted on our county website, which is www.brevardfl.gov. And this is really important, is that there is currently a moratorium on evictions because the governor knew that people would suffer financially. That moratorium, however, is due to expire March 31st. And as of today, there's been no extension of that. So we know that it's more important now than ever that if you are needing assistance, you need to get those applications in as soon as possible. So far, the county has received over 530 applications, and we've approved grants for 75 of those, but obviously we have many others that are being processed, but there is still money there available. So please help yourself as much as you can, fill out those applications, and hopefully we can help you continue to stay put where you're at for the months ahead. Catherine Allen, who is with Brevard Public Schools, is here today to provide an update from the school system. Catherine?
Thanks, Don. Again, my name is Catherine Allen from the Division of Government and Community Relations with Brevard Public Schools. And first and foremost, we want to say a really special thank you to the local health department and other medical health professionals in the area who've really created partnerships with us to provide vaccines for our eligible employees. I can tell you that there's a large sense of relief among those who've received them, and they're incredibly appreciative. So it's definitely helping our staff feel more comfortable and safe in their environments in which they're teaching our students. In terms of where the district is, as Maria mentioned, we're seeing a stability. Our numbers aren't going up, they're not going down. We did just have spring break last week, so I'm sure that we'll see some sort of adjustment to those numbers in the coming weeks. But at this point, we have a total reported caseload of 2,568. And so that's less than 1% of the total population of our students and staff. So we're still pleased with that. We haven't seen any large outbreaks in our schools. We haven't had to shut down any of our schools in quite some time. And our schools continue to do a wonderful job with, mitigation protocols, just, continue with the social distancing, mask wearing, hand washing. We're super appreciative of all of the work of our staff and our students in being cooperative with that. And the last thing, we want to make sure that our community knows that kindergarten kickoff registration, that's next week, okay? So kindergarten enrollment, next week it starts, the 29th of March. You can go to brevardschools.org. You can click on the kindergarten kickoff banner, and you can find all the information there, or reach out to your local elementary school if you have questions. That's all, Dawn.
Thanks, Catherine. I've been notified that I misspoke on the rental assistance. It does not pay for security deposits. So my apologies on that, but everything else I said is correct. So we do monitor our Facebook Live event for questions that are posed by those who tune in to watch. And I understand we have some questions today, and I'm going to turn it over to Jesse Ray, the county social media specialist, to pose those questions, and we'll respond as best we can.
Excellent.
Jesse?
Thank you, Don. So, a couple of questions we have. Do you believe the public's interest in getting vaccinated is dropping off, with the people most wanting a vaccine already having gotten one?
I'll take that one.
Sure.
The short answer is no.
Got it. Why do you think the percentage of people 65 and older who have gotten a vaccine in Brevard County is nearly 10 percentage points lower than the state average?
I'll also take that one. Those numbers can be a little misleading when you try to look at statewide averages, because we're 67 counties and we're very different demographically. Brevard County has 150,000 folks over 65. It's about a quarter of our population, give or take. It simply takes us longer to make a larger dent in that, especially when you look at the limited supply of vaccine. I think if you compare where we are to other counties who have similar percentage points on their senior population that are, 150,000 plus seniors, you'll see we're right in line with them.
Excellent. Thank you. And can you explain the use of local fire stations as vaccine sites? There is one in Cocoa Beach. Are there others? And what are the qualifications to get a vaccine? How do people sign up?
Sure, so I'll take that one as well. So I talked earlier about working with community partners to continue to expand availability and try to get vaccine closer to our residents and move out of just the Viera-only option, plus all the pharmacies. So we've been working very closely with all of our cities, and this week we started an operation where we started to get some more cities online to become vaccination distribution points. So Cocoa Beach is one, Satellite Beach is one, Cape Canaveral is one. We've got more cities coming online in the next couple of weeks. It's a lot of resources for them to pull together. We're very appreciative of the work they're doing, because not only are they providing the staff to do the vaccination and the administrative support to make that happen, but they are scheduling as well directly with folks. So if you are in one of those cities that comes out and it is participating, you can contact your city and they'll do that. And if you're not sure if they are, continue to come to our website. We update it every Wednesday night or Thursday morning, just depends on when it posts, with cities that are participating. So,
Thank you. With the new eligibilities, do people have to wait until the day that they're eligible to register for the appointment? So for 18 and older, do they have to wait until April 5th to register, or can they register before that?
so I'll take that one as well.
Okay.
So on the eligibility as it expands, from the state registry standpoint, the one Don mentioned earlier and that was on the screen earlier, those you can sign up for today. You don't have to wait till you're eligible. You just fill out the information. It will track that, and then once you become eligible, it will put you into the queue. For the pharmacies, that works a little bit different depending on which one. Some you can sign up for and wait a little bit, and some, once you click I'm not 40, for example, starting Monday, or today I'm not 50, then it says you aren't eligible, come back when you are. So it varies slightly pharmacy to pharmacy.
Okay. Do you think that spring break will bring a rise to our cases here in Brevard County?
I guess I could start with that. It potentially could, and it potentially couldn't. I mean, we don't know. We have seen, obviously, over the holiday breaks, we did see a surge after the holiday breaks. So it's hard to say. A lot of the spring breakers that come into our county go back to other states. So it's really unknown. The real concern, like I said earlier, is that we are stable. We're not decreasing. So it's very possibly it could increase.
Okay, thank you. John, is there any update on the Johnson & Johnson supply? I know last time, I think we kind of talked about getting some.
Yeah, so I'll talk a little bit about Johnson & Johnson. It's, again, one of the 3 approved manufacturers at this point for the COVID vaccine. We talked about it, when we first were, and the idea of Johnson & Johnson was going to come online, and once they came online, we know that supply is limited, just like we saw with Pfizer and Moderna early in its approval period. It takes a little bit for them to scale up operations. I know Johnson & Johnson is working with some other facilities and some other partners in pharmaceuticals to get out those shots. So I think you'll see an increased version of that. I know right now Johnson & Johnson is sort of scattered. Some pharmacies have it, some don't. We don't really have a lot of it at the health department, and that's true statewide. I think in the coming weeks and certainly in the coming month, you'll see that availability increase.
Okay. So I know that we've talked about this a little bit in previous episodes. How do we get off of the state list? We keep getting phone calls. How do we not get phone calls anymore? I've already been vaccinated.
Yeah. So a couple of things with that. This has been an issue statewide that we've continued to raise, as everyone has raised it as well. My understanding is the state's system now will allow you to go in and log in and actually remove yourself from the list.
Okay.
Also, there is a helpline, which you can find on our website, where you can call and they can manually remove you. And then lastly, if you do still get a call, we encourage you to tell that person, thank you, please remove us from the list.
Okay.
So those are the options as they stand.
Excellent. Thank you. And when you're making an appointment, is there a possibility to request a particular vaccine?
No.
Okay.
Not at this time in Brevard.
You got it. So, Dawn, this I think is going to come back to you. What is the approximate processing time for people who are applying for assistance?
I don't know what the turnaround on that is. I do know that they have staff members that are devoted to processing those applications. And I do know that we also realize that people are up on against this eviction moratorium, the end of that. So I think they're trying to get as many of those processed as soon as possible, but I can't give you an exact time frame. And I also, when I said that they're not doing security deposits, we are waiting really for word from the federal government if they're going to allow that moving forward. Mm-hmm. So it's kind of on hiatus. So while I did misspeak, it is something that's kind of in the ether right now, that we're just waiting word from the federal government if they're going to broaden the categories of eligibility as far as assistance that's available from the county. So.
Okay, excellent. Maria, those who are being vaccinated in other counties, such as Orange County, does that count toward our statistics that we talk about during these updates?
Yes, the statistics relate to county of residence.
Okay, excellent.
So we have time for one more question, really, right?
Okay, yes, thank you. And last question, do you have to be a city resident to be vaccinated by the fire departments?
No.
Okay.
As we've been with this entire time, vaccines are open to all Florida residents, both full-time and seasonal.
Beautiful. Thank you. That's all I have today, Dawn. Thank you.
All right, thank you. So that concludes our discussion for today, and we will be back in 2 weeks at 11:30 a.m. And as Maria stressed, please continue to follow those CDC guidelines. Stay home if you're sick, wear a face mask, social distance, and avoid large crowds. And stay safe out there, Brevard.